Dr. Myeni, welcome to the COVID-19 conversation with the small, medium, micro enterprises.
Thank you, Mr. Sibiya. It is indeed my pleasure to be here. Thank you for hosting me.
Dr. Myeni is a seasoned entrepreneur. He founded the Institute for Leadership and Research. He also founded SeniNhle Occupational Health Services. Dr. Myeni will be sharing with us his insight with regard to issues of COVID-19. Dr. Myeni, how must the small, medium, micro enterprises respond to this pandemic?
Mr. Sibiya, this is a very important topic. It is quite pertinent for all organizations, but in particular for small and medium-sized enterprises. There are quite a number of ways that small and medium-sized enterprises can respond to this pandemic. But most importantly, they need to stay informed about what is happening. As issues evolve, as more information becomes available, small and medium-sized enterprises, they need to keep informed and ensure that they understand what is happening, what is evolving, and how they should respond as far as ensuring that as employees go back to work, they prevent the work environment from becoming a source of transmission of COVID-19.
What would be your advice, Dr. Myeni, given the plethora of information that is taking place at the level of the social media? What would be your advice to small, medium, micro enterprises in trying to ensure that the sources of information that they're utilizing together is credible?
Mr. Sibiya, sadly, we find ourselves in the midst of a lot of information. Some credible, some unfortunately not so credible. So it is important for small and medium-sized enterprises to differentiate between credible sources of information and sources that are not so credible. I'll recommend that small and medium-sized enterprises consult credible institutions such as the National Institute for Communicable Diseases, the National Institute for Occupational Health, which are based in Johannesburg. They also need to consult with the Department of Employment and Labor, as well as the Department of Health. Internationally, they can consult the World Health Organization. So all these organizations have got websites that small and medium-sized enterprises can visit. Over and above, small and medium-sized enterprises, they can appoint someone within their organizations who will be a reliable source or a reliable link, who can extract information and share with everyone in the company to ensure that the information that small and medium-sized enterprises are exposed to is filtered and is credible.
Yes, Dr. Myeni. SeniNhle has extensive experience in occupational hygiene, spending almost 20 years. What will be your advice on the role that is played by the occupational hygienist in trying to ensure that the transmission of COVID-19 is prevented?
Mr. Sibiya, occupational hygienists deal with quite a number of health hazards in different work environments. They are quite experienced in the identification, evaluation, and control of workplace hazards. In this particular case, SARS-CoV-2, or the coronavirus that we are dealing with, is one of the biological hazards. Occupational hygienists can be a very good source for organizations, for companies to consult when they want to institute control measures in their work environments, because occupational hygienists form an essential part of an occupational health and safety team, specifically the occupational health team that deals with issues of health risk assessments. So occupational hygienists are skilled as the identification, evaluation, and control of workplace hazards. So small and medium-sized enterprises may not necessarily have to employ a full-time occupational hygienist, but it will be advisable that they consult with occupational hygienists as they put together their programs to prevent the transmission of COVID-19 within their work environments.
Thank you, Dr. Myeni. A lot has been said about cloth masks, that they prevent the transmission of COVID-19. Are cloth masks effective in preventing COVID-19?
This is a very controversial issue, Mr. Sibiya. Cloth masks are an essential element of a bigger strategy to try and prevent transmission of COVID-19. But what is important is that, like any other personal protective equipment, when they are used on their own without being part of a bigger strategy, they may not necessarily provide the effectiveness that is desirable. First and foremost, cloth masks are not necessarily part of a respiratory protective equipment that can be used, for example, in the healthcare environments. They are a mere barrier that prevents a spit from the mouth of a person so that it does not land on a surface. So as people speak, as people talk, there may be, for example, spits, saliva, aerosols, and all sorts of particles coming out. So the cloth masks are there to serve as a barrier to limit the spread of those aerosols. They are not necessarily protecting against coronavirus per se. They are just a barrier that limits the spread of saliva and aerosols coming out of the mouth of the person. So what is more important also is ensure that when people are wearing the cloth mask, which they need to wear, by the way, they understand how to wear them correctly. And also, if you are exposed at your work environment to other hazards, like chemical hazards, for example, you need to wear appropriate personal protective equipment, appropriate respiratory protective equipment, because the cloth masks are not going to protect you against exposure to the chemicals. If you are welding, the welding fumes are not going to be prevented from reaching your respiratory protective equipment if you are only wearing the cloth mask. So whilst they're important, they're a bigger strategy of prevention, we need to understand the context of wearing those cloth masks. That is where the guidance from professionals such as occupational hygienists become critical so that we wear appropriate protective clothing and equipment.
SeniNhle, as the company that specializes in occupational health and hygiene and employs professionals and experts in the field, what will be your message that you would like to give to the small, medium, micro enterprises as we conclude this discussion?
Mr. Sibiya, I would say small and medium-sized enterprises, they need to keep abreast with information. They need to make sure that they protect their workers. They need to consult with their workers, small as they are as an organization. They need to make sure that they are well informed of what is happening. Where there is any doubt, they need to consult the National Institute for Communicable Diseases, the World Health Organization, the National Institute for Occupational Health, World Health Organization, and many other credible organizations that can assist them and guide them. So they need to consult professionals so that whatever strategies that they've put in place, those strategies are actually effective and they work as they need to.
Thank you very much to you, Dr. Myeni, for your invaluable insights and inputs. We'll also want to extend our gratitude to SeniNhle Occupational Health and Hygiene for their invaluable information that they've shared with us. Thank you very much, Doctor.
It's my pleasure, Mr. Sibiya.
Thank you.